I happen to do a lot of tummy tucks in my practice, and I notice that a lot of my patients, and as a matter of fact, a lot of physician friends that I have, don't really understand exactly how a tummy tuck is done. So I thought I'd take a minute to explain, sort of, how we go about doing the procedure. I've put up a couple of photographs of a patient I did, probably 2 years ago. I think she's a good example of the advantages and the benefits of the procedure, as well as demonstrative of how the procedure is performed. If you take a look at her images here, you can see that she certainly has a little bit of a rotund belly with some excess lax skin down here at the bottom, sort of overhanging her panty line. Well, with a tummy tuck procedure, what we do is essentially remove all of the skin from the belly button down to the area of the pubis. The benefits, as you can see in this example, are fairly significant as well. In this picture you will see that the sort of the belly paunch, or the pot belly area, is completely flattened. This picture was taken about 6 months later. You'll also see that her outie belly button is newly tailored and again is flat with her abdominal wall. I have pictures of her from the front as well that I want to show you. And if you see here, rather than having a rounded belly after frankly having a few children, she is nice and flat again. She tells me like she looked before being pregnant at all. Also, the only scar that should ever show generally in a tummy tuck procedure is the scar around the belly button. And I'm fairly particular. I like my belly buttons to look as though there was never any surgery. Online, if you look below outside of this video, you will see a close-up of her umbilicus. And in this case, you can certainly see that there's a little bit of a hood above, and the only scar that will show is a very short one below the belly button. Again, there is a long scar, I admit that, but it is typically covered by panties or bathing suit. It does go, for instance in this patient, from one hip across the lower belly around to the other hip. And in general, I think that this is a worthwhile procedure. By the way, from the front you can see that the tummy skin from the belly button down to the pubis has been removed. So if there were any stretch marks or attenuated, unfavorable looking skin in this area, it is all removed, and the skin that ends up in this area actually originated above the belly button. This is how a typical tummy tuck is performed. I happen to do a lot of them in my practice, and I'm very proud of my results. I invite anyone to come by who's interested, and I'll explain what we might be able to do for you.